Good morning. My name is Romuel Binuya, and I'm here to do a podcast for my subject Advanced Professional Practice as part of my Task 3 assignment. Here with me today is Ms. Mirasol, who gladly took the offer to be part of my podcast. Ms. Mirasol has been working as an Associate Nurse Unit Manager in Western Health for more than 10 years now. Thanks for your taking time for today for this interview.
Oh, my pleasure. Thanks for having me.
Topic I'm presenting today, by the way, is a feedback as a tool for performance appraisal. Feedback, as we all know, is about information about a reaction to any product or a person's performance of a task, which is used as a basis for improvement. Performance appraisal, on the other hand, is a regular review on an employee's performance and contribution to the company. My first question is, how can we use feedback as an effective performance appraisal tool?
To become effective in giving feedback, I think it needs to be clear and specific. We use appraisal tool to encourage and increase morale of the staff. It needs to be encouraging. If staff are motivated and have understanding of the information being fed, then I think it's easier to accept feedback and highly likely that it will be effective. You know, the tool you're giving is effective if your staff members are learning and improving. If they are aware of the purpose and have definition of what that feedback is all about. I'm very cautious. I'm very cautious of this of giving feedback, as it's not easy. Each time I give feedback, my goal is to support and guide them. I always think that, focusing on the current task or the behavior that the staff need to change and not the person. I wanted to make them feel that they're not being attacked or targeted. It's important that at the end of your conversation, they know the purpose of what outcome you both want to achieve. It should be direct and detailed to avoid miscommunication. I do believe that whoever is giving feedback should be specialized or expert in that area that your team members are performing. Otherwise, you'll not be confident or comfortable in giving feedback. Leading them and giving directions would increase the chance of changing their behavior and performance if you know what you're doing, or if they know that you know what you're doing.
Thanks for that. Giving feedback is not easy. I personally think that there are barriers that needs to be overcome. These are perception of insufficient time, lack of direct observation, lack of training, not enough objectives or goal. And probably the difficult one for me is fear of learners' response. My next question is, can you cite instances in a clinical setting when you encountered challenges while providing feedback to your nurses?
Ooh, I've got a lot. Nah, I'm kidding. I've got a few that I can think of and I can share that, yes, it's quite challenging. One example is patient has been extubated and I was not aware. I just found out when I was doing my rounds. The unit policy is before extubating a patient, ICU in charge needs to be informed.
By the way, extubated means that someone put a breathing tube into the patient, and that tube is about to be taken out because the patient's already started breathing.
Yeah.
If for someone who doesn't know extubation.
Yeah. So, to sum it all up, the ICU in charge needs to be informed before that happens. So, for someone who works for a long time in the unit, I expect that the bedside nurse knows that the policy for extubating the patient. So, feedback should be given right there and then, but I have to be mindful of appropriate timing. Working in ICU is a stressful environment, dealing with critically ill patients. It's hard to step away from the patient and give feedback in a closed door. In this situation, I have to give it in front of a group or with my team members. The problem is that the individual nurse or the bedside nurse won't have a clue or an idea on how to improve her communication by targeting specific practice of concern to correct such actions if the feedback is not given directly. At times, you need to postpone giving feedback and deal with it when timing is good. But then again, you do not want to leave it for so long that you cannot do anything to improve the situation, or the person that you're giving feedback to already forgotten about it. If the safety of the patient is compromised, I give feedback right there and then. I focus on the performance of the staff, like examining the problem and mistakes, have a clear discussion, learn from it, and move on. Another challenging situation is when the same person kept on making the same mistakes or keep repeating unacceptable behaviors. I experienced it and I have to remind myself to stay calm and kind, keeping the communication professional when giving feedback. People have different traits and personalities. Some of them have fragile characters. You probably have experienced that, yeah?
Yeah.
Yeah. And then some of them have pride and do not accept any feedback. They wanted to hear only the positive and unable to comprehend when it comes to negative feedback. In this situation, I always ask what led into that situation rather than assume. After listening to the situation, I assess and review. If it's lack of knowledge and skills, then I teach what is required. Miscommunication is another common thing in a clinical setting. The environment is not conducive to it's not a conducive place to give feedback. Most of the time, you're quick and short in giving information. The nurse in charge have lots of phone calls and distractions. Or sometimes the bedside nurses are preoccupied in nursing care. They tend to misinterpret and set aside the conversation. So the discussions of strategies for improvement would be taken for granted, or setting expectations and being at the same page is harder. I always make sure that the purpose of the discussion is to improve the quality of care being given to the patient by having a standard and prioritizing safely.
Wow, very nice. On my last assignment, I have discussed the 3 models of feedback that were commonly cited in literature as effective, namely SPI feedback model, which stands for Situation Behavior Impact Model. To sum this up, you capture the situation, describe the behavior, and explain the impact that the person's behavior had on you or the company. The other one that I discussed is the BOOST model, described as balance, observe, objective, specific, and timely. And lastly, the manager tools feedback model, which is described as behavior and impact focused feedback model. My third question is, how do we use the different feedback models in providing positive feedback technique to our nurses?
Honestly, I'm not familiar with the ones that you've mentioned. I'm only familiar with the one that I usually use is constructive feedback and praises. The first one is constructive, which I include the following, okay? Correct the past mistakes for the staff not to repeat the same mistake. Affirm to continue good work they've done. Teach to avoid or prevent future mistakes. And coach to improve performance in the future. In my experience, I find these strategies helpful and effective. I use praise feedback as well when I know that staff are overwhelmed with the work they do. You know how sometimes we get too busy?
Yeah.
I use positive statements to uplift their spirit. Paying attention for all the hard work they do and looking after their well-being is utmost important. If you boost their self-esteem, then they respond better. The more confident they are, and then you'll see or you feel that your feedback is effective. I'm not a fan of sandwiching negative feedback. I do separate the good and the bad behavior. I truly believe that regular catch-up with the team members is effective. Giving constructive feedback at the right time with the right approach and clear expectation is the key. It's important that you do not wait for a year to sit down with them to do the performance appraisals. As far as I'm concerned, the strategies that I'm currently using is effective. Most of the staff members respond well. They are very appreciative and engaged each time we have informal discussion.
Thank you. Thanks. I think that's about it for my 3 questions.
Thank you, Rom.
Thanks for your
You
time.
actually made me reflect and review on how I give feedback to the staff members.
Thank you. It's really a pleasure hearing your thoughts in regards to using feedback as a tool for performance appraisal. Any last word before we say goodbye?
Well, all I can say is good luck with the masters, and I'll see you in the ward.
Okay.
In the unit.
All right. Thank you so
Yeah.
much. Thanks again for your time, and I really greatly appreciate you
My pleasure.
spending time with me and helping me with my task.
Anything for
assignment.
you.
All right. Thank you.
Bye.
Okay. Bye.